Good evening. On the 28th day of the U.S. federal government shutdown, concern is growing over the suspension of food assistance for approximately 42 million low-income people. The Department of Agriculture announced that there will be no SNAP payments on November 1, 2025, citing in a statement that the well has run dry. This measure has opened a new front in the legal battle. At least 25 states and the District of Columbia have filed lawsuits to compel the federal government to use emergency funds and prevent the program from being suspended. Attorneys argue that there are sufficient contingency funds to cover part of the November cost and that the shutdown should not fall on vulnerable families. A federal court has scheduled a hearing for the coming days. According to recent documents and reports, the administration claims that the approximately $5 billion in reserves cannot be used in this context and, in any case, would not cover the approximately $9 billion needed for a full month of benefits. In 2018 and 2019, during another prolonged shutdown, the government advanced payments to avoid cuts. This year, the official position is different. If the suspension is confirmed, it will be the first time in the program's more than 6 decades that one-month payments could be interrupted. Experts and economists warn of immediate impacts on consumption, local commerce, and the food security of millions of families in every state. The shutdown also affects those who keep the country moving. Air traffic controllers, considered essential, work without pay and report 6-day work weeks. This Tuesday, many received zero paychecks and delays were reported at major airports due to staffing shortages. Airlines and unions confirm support actions as the impasse continues. On Capitol Hill, the debate extends to health care. Democrats are conditioning an agreement to reopen the government on the renewal of the expanded tax credits under the Affordable Care Act, which expire at the end of 2025. Independent research estimates that without this extension, premiums for individual health plans would rise significantly starting in 2026, putting pressure on family budgets. Republicans dispute these projections and argue that the issue should be negotiated after the reopening. Leaders of the ruling party are also facing internal criticism. In recent public statements, a Republican congresswoman demanded a detailed plan for health care costs, exposing divisions in the party's strategy during the shutdown. The Speaker of the House acknowledged the disagreements but stated that discussions are ongoing. Meanwhile, state governments in different regions are evaluating temporary measures to mitigate the lack of food assistance, including using their own resources, although they warn that there is no guarantee of federal reimbursement. The priority, say local authorities, is to avoid gaps in assistance for families with children, the elderly, and people with disabilities. In summary, on the 28th day of the strike, SNAP benefits are at risk of ceasing on November 1st, with lawsuits underway and essential services operating under pressure. The outcome depends on an agreement in Washington that includes government funding and negotiations on health care. Until then, millions await a resolution that impacts food, work, and household budgets across the country.